Next speaker is Dr. Thomas Guttuso. Many of you are familiar with Dr. Guttuso, and I have to mention that, by the way, the name of his presentation today was printed in error. It's actually research treatments for Parkinson's. So if you're following the play-by-play on your sheets, he's going to be speaking today about research. And just want to say that he is an Ivy League educated gentleman. Very strong roots in the local community, many years at UB and the University of Rochester. He's currently the Associate Professor of Neurology at UB. He's a member of the Parkinson Study Group, allowing him international connections to cutting-edge research studies. He's working on assessing the application of MRI imaging to detect changes in cognitive performance with Parkinson's, and he's been recognized with numerous awards, most recently the Patient's Choice Award. So obviously you like him, and that was in 2015. So without further ado, Dr. Guttuso.
So I'm tethered up here. I wish I could wander like Dr. Drew was doing. So I'm going to be talking about promising new research, and this is after studying Parkinson's for about 20 years plus, taking care of Parkinson's patients for about 13 years plus. There are some really exciting things. There's some real exciting discoveries that we've come to understand over about the past 8 years. And so I'm really happy to share them with you today. I just want to start just with a shout out to Dr. Kim Trinidad. So she took care of a lot of people in this room for a long time. She was a big part of the Symposium for all 16 years. And as you know, she retired last year. We really miss her. We hope she's doing great in her retirement. I hope she's having a great time, and we miss her, love her, and wish her all the best and thank her for her years of service to all of our patients with Parkinson's. We're so excited to have Dr. Andrzejewski here with us working in the deep brain stimulation department. So I'm going to start with this picture. Fritz Lewy, 1912, discovered Lewy bodies in Parkinson's disease brain. Parkinson's disease was first described in 1817 by Dr. Parkinson. So we're coming up on 200 years of kind of the discovery, or at least the description of Parkinson's disease. And it was about 100 years after that that this doctor discovered these Lewy bodies in the brain. So we've known about this for a long time. It's been over 100 years, and never really knew what these Lewy bodies were all about. More recently, we've come to terms that these are comprised of these aggregates, these protein aggregates called alpha-synuclein. That's the main component in Lewy bodies, and this is a picture of a Lewy body in one of these dopamine cells within the brain of a patient with Parkinson's. And again, we never really knew what this alpha-synuclein was doing. Is this part of the cause of the disease, or is this just a byproduct of the disease? Well, again, like I said, over the past 8 years, there has been mounting consistent research that alpha-synuclein very likely is the cause of Parkinson's disease, and more importantly, is the cause of the progression of Parkinson's disease. And this is very exciting work because it completely redirects researchers, industry to focus on these abnormal protein clumps in cells. And it's not unique to Parkinson's disease. Parkinson's disease is the number 2 most common neurodegenerative disease. The number 1 is Alzheimer's, and Alzheimer's also has these abnormal clumps of protein. They just happen to be called tau. Tau tangles. In Parkinson's, it's alpha-synuclein. We call them Lewy bodies. Really, all neurodegenerative diseases have these abnormal clumps of protein. You can think of them as little hairballs stuck in cells. So the focus has really been redirected towards trying to get rid of these, trying to prevent them from forming in the first place, and trying to clear them, and trying to prevent them from being transmitted from cell to cell. So you're going to hear about this with some of the new therapies that are being researched. I'm just going to talk about therapies that are designed to help slow down the disease. I'm not going to talk about therapies designed to treat the symptoms of the disease. These are more disease-modifying therapies. It's really the big treatment need in Parkinson's disease is to try and slow this thing down, maybe stop it in its tracks. There's one therapy I'm talking about that has a little hint that it actually may help reverse symptoms. So these Lewy bodies are known to start in Parkinson's in this little tiny spot right here, the olfactory bulb, which is where we detect smell. It also starts sometimes in the brainstem, in the lower part of the brainstem, which my cursor just disappeared. There it is. Or in the gut. So Parkinson's disease probably starts years, if not decades, before patients notice they have Parkinson's or doctors notice they have Parkinson's. We really believe Parkinson's starts decades before, either in the gut with constipation, with loss of sense of smell, sometimes with this sleep disorder, which a lot of you probably have, which is you act out your dreams, this REM sleep behavior disorder. These are all premotor risk factors that as they mount and the disease and these Lewy bodies continue to march their way up the brainstem, eventually they get to the substantia nigra in the midbrain and start affecting dopamine levels. Once dopamine levels get low enough, that's when your tremor comes out, that's when the stiffness and slowness and the shuffling gait, and that's when you get diagnosed with Parkinson's. So that's a kind of a mid-stage when the dopamine cells are being lost. As the disease progresses over another 10 to 20 years, we get more non-motor symptoms that we heard about, more trouble with balance, more trouble with memory, and these are more difficult issues for us to deal with and for us to try and make an intervention. It's more preventative therapies. We do not have good treatments at all for dementia. So really, Parkinson's disease, if you just kind of compare it a little bit to Alzheimer's disease, it's good news. We get a warning sign that we can see with tremor or slowness or stiffness that we can intervene much earlier than in the most common neurodegenerative disease of Alzheimer's disease. Those patients have a lot of cognitive problems right when the time of diagnosis. So we've probably got a good 10-year window to try and get some disease-modifying therapies on board in patients with Parkinson's to try and prevent the disease from spreading from this stage to this stage. So let's just talk about some of these new promising therapies. I mentioned alpha-synuclein, which is the main protein that clumps up in cells, and we strongly believe is the main contributor to the death of these dopamine cells and later other cells besides dopamine cells. There are immunization therapy trials that are going on right now. These are early stage trials, phase 1. When you hear about clinical trials, so these are research studies are being done in humans. So this is not in rats and mice, this is in humans. Phase 1 is safety and tolerability. So that's the initial time that these therapies are used in humans. We just want to make sure they don't cause a lot of bad side effects, they don't cause liver failure, they don't cause kidney failure, et cetera. So there's a small groups of patients, very first trial in humans. And so these are all in phase 1. There's 3 different molecules that are being used for active immunization. So it's a subcutaneous injection, just like you'd get immunized for, mumps or chickenpox. And these are all being enrolled in Austria. They have been shown to be safe and well tolerated at 2 different doses. 50% of subjects did have detectable antibodies in their bloodstream, so it's giving a hint that the vaccinations are actually forming the antibodies that we want to form to try and clear these abnormal proteins from the brain. So this is phase 1. They're going to be hopefully going into phase 2 soon. There's also a passive immunization study that's going on in the United States. And so this is forming the antibodies, monoclonal antibodies, and then giving them to patients through an infusion. So instead of giving them an injection and having the body form the own antibodies, we give the antibodies in the monoclonal state. And it did show a reduction of alpha-synuclein in the bloodstream was also safe and well tolerated. So now this is going to move on to phase 2. So we really don't know if this is actually going to help patients, but it's targeting what we believe is the main cause of the disease. So another therapy that is still in phase 1, I have these organized from phase 1 through phase 3. So early stage development of a neurotrophic factor. There was a lot of hope for neurotrophic factors for slowing down the disease. There's been a bunch of stumbles with some early studies. GDNF, glial cell-derived neurotrophic factor, is the one that showed the most benefit in animal models. So that's patients are being enrolled right now. And it's using gene therapy to deliver this to the striatum, part of the basal ganglia. So that's phase 1 with this trial using gene therapy. This is one that's gotten a tremendous amount of press. I've had a lot of patients ask me about it in clinic. I can tell you, I'm very excited about this particular drug target, this particular drug, and the whole category of tyrosine kinase inhibitors, but it is very, very early. Nilotinib, it's a cancer drug, so this is, you're going to hear about a variety of different medications that are FDA approved, available, but they're FDA approved for something else, not for treating Parkinson's disease. This particular drug is FDA approved for treating cancer. It's for treating leukemia, chronic myelogenous leukemia, CML. In higher doses, it's used for leukemia. What the researchers at Georgetown showed is that in lower doses, it appears to stimulate brain cells to clear these abnormal proteins. It's a process called autophagy. And at low doses, that's what nilotinib was shown to do in petri dishes and in animal models. And so a movement disorder specialist there, Fernando Pagan, did a very small phase 1 study. And he presented it last year, and he's presented it in a couple meetings, and showed that in these 12 patients who were given low-dose nilotinib for 6 months, it was safe and well tolerated, number 1. And number 2, several of the patients really showed some pretty impressive improvements in their symptoms, where they had not only improvement in their motor symptoms of stiffness, slowness, and tremor, but they also had improvement in cognition. This was studied both in patients with Parkinson's disease and patients with kind of a related condition called Lewy body dementia, which also has these alpha-synuclein aggregates, but has more cognitive problems. And many of the patients were actually able to decrease their dose of levodopa medication. So they were showing benefit even though the levodopa dose was being decreased. After the study ended, after 6 months, the patients were taken off of the medication and several had worsening in their symptoms. The drug company has allowed patients to go back on the drug, and by the report, many of the patients have started to get improvement again. So it's really exciting. One of the most exciting things, just from a research point of view, is that these patients also underwent spinal taps, and so their cerebral spinal fluid was analyzed for these proteins. You can measure these abnormal proteins in the spinal fluid, alpha-synuclein, and 2 other proteins that are more related in Alzheimer's disease significantly decreased from baseline, giving a hint that maybe this nilotinib is doing in humans what the researchers at Georgetown also saw it doing in animal models, namely decreasing these abnormal protein clumps. So it is very exciting. It's very, very early. The drug is extremely expensive as well. It's somewhere between I think $4,000 to $10,000 a month. I heard an audible sigh from the crowd. So this group is planning on doing more clinical trials. So we'll kind of wait and see. Nicotine patch. So nicotine's been studied for a while based on observation that smokers develop Parkinson's disease at much lower rates than non-smokers. And it's about a 50 to 70% reduced risk of developing Parkinson's if you're a smoker. Don't go start smoking. Not recommending that. Smoking has a lot of health risks, and also it's important to note, if any of you are familiar with this research, these are observational studies. It may be just as likely that the genetic makeup of people who are inclined to smoke are also less inclined to develop Parkinson's. So it may have nothing to do with causation. Nevertheless, obviously, one of the main compounds in cigarettes and tobacco is nicotine. There's been a lot of research on nicotine. The clinical trials on nicotine have not been very impressive. I think this is kind of the final hurrah for nicotine, so we'll wait and see. This is the biggest studies being done right now with a nicotine patch. Enrollment's been in Germany and the US. It's still ongoing. They're trying to enroll 160 patients to see if nicotine can help symptoms in Parkinson's. Obviously, nicotine patch is currently available. Intranasal glutathione. Glutathione, I hear from patients, they're asking me about, should I take glutathione? This is a supplement you can buy over the counter. I tell them no, because it gets broken down in your gut, and whatever gets into your bloodstream is not going to even get into your brain. It does not cross the blood-brain barrier. This group is looking at intranasal glutathione to try and bypass the blood-brain barrier. And so this is a phase 2 study that's enrolling in the United States right now. Glutathione is an antioxidant, and it's the main antioxidant system in the brain. And in patients with Parkinson's disease, it's been shown the glutathione levels are very low in the dopamine part of the brain, the substantia nigra, compared to healthy controls. That's kind of the background for that research. Exenatide is another very interesting compound, currently FDA approved for treating diabetes. Exenatide is an injection you use once a day or once a week, and has shown benefit, again, protecting dopamine cells. And this research has all been done in the UK and London. The phase 1 studies showed very interesting results. These 45 patients who were given exenatide, they were randomized to either exenatide or to nothing at all. So it was not a blinded study, but patients showed improvement in motor and cognitive symptoms even a year after the exenatide was stopped. So now they're doing a larger phase 2 study. And one of the side effects was weight loss, because this does decrease glucose levels. Isradipine is a FDA approved for treating high blood pressure. This is in phase 3 studies right now, and it was shown in phase 1 that the 10 milligram dose was safe and well tolerated, and the phase 3 is going on now. This is a long study, 3 years of follow-up to see if this calcium channel blocker, isradipine, can help slow down the disease. Finally, Inosin is an over-the-counter dietary supplement. It's a precursor to urate. It increases uric acid levels. If anybody here has ever had gout, you know what uric acid is. If your uric acid level gets too high, you get gout. Bad, very painful. Swelling in the toe and in the ankle. Also can develop kidney stones. In the phase 1 trial, it was well tolerated, but 3 patients did develop kidney stones. A phase 3 study is going on right now. Enrollment's going to start soon. It's going to be a big study, 270 patients. Again, the theory behind this is that urate is a antioxidant. And there's been evidence that patients with Parkinson's who have high urate levels progress much more slowly. And so that's the background behind Inosin. And finally, some guys riding their stationary bikes. Hey, buddy, unless you're passing, get out of the left lane. So we heard Dr. Giroux talk about exercise. We've heard about the benefits of dance, the benefit of moving. I talk to my patients all the time. Really try and make exercise part of your daily routine. It's one of the best things that you can do for yourself right now. It doesn't involve taking medications. And there is good evidence that it does help slow down the disease. It's certainly not rock solid, but it will give you many benefits in many different facets, especially non-motor systems. So thank you very much.